Our Back to School series continues with the ABCs and Ds of health for your students. Here to tell us all about that is Dr. Rob Danoff of Aria Health. Dr. Rob, always great to have you with us. You have great information. You know, we send our children off to school for so many hours in the course of the day. We want to keep them safe. And you say there are ABCs that every parent can follow. Tell us about that.
The alphabet of health. So let's start off. The school needs to know about your child's allergies. And people think it's just medications, but no, it's not just that. It could be food allergies. Could it be peanuts? Could it be eggs? Very important for the school and the school nurse to know that.
Okay, let's look at the B's and the C's.
Okay, we got B's. You want to make sure that, we're be careful, but B's, we want to make sure that any medical conditions that they know about, so that's the C. Also, be immunized. Very important. Meningitis for college kids, the meningitis vaccine, the measles vaccine, very, very important. And then we're going to skip to D for drugs. We want to talk to the kids in a non-threatening manner about what we think about recreational drug use or alcohol. If you have these conversations in a gentle tone throughout their childhood, this way it's not a shock when you talk to them.
And E then is for emergency numbers. I would think that you need to make sure that your school has all of the right numbers to reach you in case there's a problem.
You know, it's so important. Not only emergency numbers for the parents. If they can't get a hold of the parents, who is a trusted friend, a relative? It's important the school has that on file, and this way they know who they're calling is the right person for your child. And then also fuel. Fuel up, Pat. We just saw the importance of good food. Do you know that children who eat a good balanced breakfast will be more alert, they're not going to be hungry, they can concentrate better, and then they're going to have better energy, and you have a better student and get those bright A's all the time.
My mom used to say that all the time. All right, now we're going to slip down in the alphabet to S, and that is for safety concerns. What do we need to think about with that?
Well, one of the first things is getting on a bus, safety on the bus. Nowadays, try to get your school districts to get seat belts for the kids, but also how to cross the street. If there's any bullies around, it's important that the child lets you know about that. Any fears that they may have on their route to school. A lot of kids walk, so you want to make sure that they're safe.
All right, so we also then have a back-to-school list for parents. Now, this is really important, too. Now, we start with scheduling a doctor's appointment for your child.
So important right now. The offices are inundated. We want to get the school physical forms done, whether your child is playing sports or the school needs to know how healthy, any medical conditions. Also, medication list. Do I need to know if they're taking any asthma medications? Backpacks. Pat, so many people wear these backpacks that are wrong for them. They carry too much weight. No more than 10 to 20% of their body weight should be in there, although I see kids with way more than that.
Sure.
Also, we talk about fueling up with the right food and snacks for their day, and also, again, that emergency contact list, including the name of their doctor and telephone number, just in case.
But this is all such great information. We're going to have it at our website at cbs3.com. Much more on Aria Health there. At cbs3.com/talkphilly. Thanks so much, Dr. Rob.
You're all
Always
set.
a pleasure. We certainly are. We get everybody else at home set as well. We have Doug's final forecast when we come back.